Hi everyone, this is Nurse Marcia. Welcome to Part 6 of our Pediatrics NCLEXRN series. Today we'll explore neurological and developmental disorders, focusing on high-yield and next-generation NGN concepts. Key topics include meningitis, seizure management, and more. Get ready for 25 advanced NGN-style questions with detailed rationales designed to enhance your critical thinking. Let's get started. Question 1. A nurse is assessing a 6-month-old with suspected bacterial meningitis. Which finding is most indicative of meningitis? A. Positive Babinski reflex. B. Bulging fontanelle. C. Sunken fontanelle. D. High-pitched laugh. Answer B. Bulging fontanelle. Rationale. A bulging fontanelle is a hallmark sign of increased intracranial pressure, ICP, in infants, commonly seen in bacterial meningitis. The accumulation of cerebrospinal fluid, CSF, and inflammation lead to pressure within the skull, causing the fontanelle to bulge. A positive Babinski reflex, A, is normal in infants up to 2 years old and is unrelated to meningitis. A sunken fontanelle, C, is indicative of dehydration, not ICP. A high-pitched cry, not laugh, is often noted in infants with meningitis due to irritation of the meninges. Question 2. When assessing for meningitis, a nurse performs the Brudzinski's sign test. A positive result is indicated by A. Involuntary extension of the legs when the neck is flexed. B. Involuntary flexion of the hips and knees when the neck is flexed. C. Pain on passive flexion of the neck. D. Spontaneous twitching of facial muscles. Answer B. Involuntary flexion of the hips and knees when the neck is flexed. Rationale. Brudzinski's sign is positive when flexing the neck causes involuntary flexion of the hips and knees. This occurs because irritation of the meninges stimulates nerve roots, leading to reflexive movement. Involuntary extension of the legs, A, is not part of Brudzinski's test. However, it might be confused with Koenig's sign, which involves resistance and pain during knee extension. Pain on passive neck flexion, C, is a nonspecific finding and does not confirm meningitis. Facial twitching, D, is unrelated to meningitis and might suggest a different neurological disorder. Question 3. The nurse understands that a positive Koenig's sign is demonstrated by which of the following? A. Resistance and pain when extending the knee while the hip is flexed. B. Involuntary flexion of the knees and hips with neck flexion. C. Pain during palpation of the cervical spine. D. Rigidity of the lower extremities during straight leg raising. Answer A. Resistance and pain when extending the knee while the hip is flexed. Rationale. Koenig's sign is elicited by flexing the patient's hip and knee to 90 degrees and then attempting to straighten the leg. Pain or resistance indicates meningeal irritation. Involuntary flexion of the knees and hips with neck flexion, B, describes Brudzinski's sign. Pain during palpation of the cervical spine, C, suggests other conditions such as musculoskeletal issues. Rigidity during straight leg raising, D, does not align with Koenig's sign but may indicate neurological conditions unrelated to meningitis. Question 4. A lumbar puncture is performed on a child with suspected meningitis. Which cerebrospinal fluid, CSF, findings support a diagnosis of bacterial meningitis? Select all that apply. A. Elevated protein levels. B. Decreased glucose levels. C. Clear appearance. D. Elevated white blood cell, WBC count. E. Decreased opening pressure. Answer A, B, D. Rationale. Elevated protein levels, A, occur due to inflammation and the presence of bacteria in the CSF. Decreased glucose levels, B, are a key indicator of bacterial meningitis, as bacteria consume glucose within the CSF. Elevated WBC count, D, indicates an immune response to bacterial invasion. Clear appearance, C, is more consistent with viral meningitis, while bacterial meningitis often presents with cloudy CSF. Increased opening pressure, not decreased, is typical of bacterial meningitis due to increased ICP. Question 5. True or false? A child with meningitis is at higher risk for developing hearing loss as a complication. Answer true. Rationale. Hearing loss is a common long-term complication of bacterial meningitis, caused by inflammation or damage to the cochlear structures. Prompt antibiotic therapy can help reduce this risk but does not eliminate it entirely. Question 6. Which statement by the parent of a child with febrile seizures indicates the need for further teaching? A. I will give acetaminophen for fever control. B. Febrile seizures are unlikely to cause brain damage. C. If a seizure lasts more than 5 minutes, I should call 911. D. I will administer anti-seizure medication daily to prevent future seizures. Answer: D. I will administer anti-seizure medication daily to prevent future seizures. Rationale: daily anti-seizure medications are not recommended for febrile seizures, as these are typically benign and self-limiting. Fever control with acetaminophen A can help reduce the risk of recurrent febrile seizures during an illness. Febrile seizures are generally harmless and do not cause brain damage. B. Seizures lasting more than 5 minutes require emergency intervention. C. Question 7. The nurse is caring for a child in status epilepticus. What is the priority intervention? Administer rectal diazepam. B. Monitor oxygen saturation. C. Establish an 4-line for medication. D. Position the child in a side-lying position. Answer: D. Position the child in a side-lying position. Rationale: the first priority in status epilepticus is to ensure airway patency and prevent aspiration, which is achieved by placing the child in a side-lying position. While diazepam A is effective in stopping seizures, it is secondary to airway management. Oxygen monitoring B and establishing in 4-line C are important but follow airway protection. Question 8. True or false? Antipyretics prevent febrile seizures in children. Answer: false. Rationale: febrile seizures occur due to a rapid rise in body temperature, not the absolute temperature. While antipyretics like acetaminophen or ibuprofen can reduce fever and make the child more comfortable, they do not prevent febrile seizures. The mechanism behind febrile seizures involves the immature nervous system of young children, making it highly sensitive to sudden changes in temperature. Parents often misunderstand the role of antipyretics, believing they can completely prevent febrile seizures. Nurses must educate families that these medications control fever but are not a safeguard against seizures. Key teaching point: focus on monitoring the child for seizure activity during febrile episodes and seek medical attention for prolonged seizures, more than 5 minutes. Question 9. Which signs indicate increased intracranial pressure (ICP) in a child with hydrocephalus? Select all that apply. A. Vomiting. B. Headache. C. Bradycardia. D. Increased appetite. E. Sunset eyes. Answer: A, B, C, E. Rationale: increased intracranial pressure (ICP) occurs when the brain cannot adequately compensate for increased fluid volume, e.g. CSF in hydrocephalus. Each correct option reflects specific physiological responses to increased ICP. Vomiting: A. Increased ICP irritates the medulla, leading to vomiting. It is a common early sign in infants and young children. Headache: B. Increased ICP stretches pain-sensitive structures in the brain, leading to a persistent headache, especially in older children who can verbalize the symptom. Bradycardia: C. A late sign of increased ICP. Bradycardia occurs as part of Cushing's triad: bradycardia, hypertension, and irregular respirations. It reflects brainstem compression. Sunset eyes: E. This refers to downward deviation of the eyes caused by pressure on the cranial nerves. It is a classic sign of hydrocephalus and increased ICP in infants and young children. Incorrect option. Increased appetite: D. Increased ICP typically leads to poor feeding or loss of appetite, not increased appetite. Irritability, lethargy, and decreased activity are more likely. Key nursing implications: monitor for signs of increased ICP in children with hydrocephalus, especially after shunt placement. Early recognition of symptoms like vomiting or headache allows for timely intervention and prevention of complications such as herniation. Question 10. A nurse is educating parents about care for their 3-year-old child who had a febrile seizure. Which statement indicates the parents require further teaching? A. I will call 911 if my child's seizure lasts more than 5 minutes. B. I will give my child fever medicine during illnesses. C. Febrile seizures can increase my child's risk of epilepsy. D. I will monitor my child for seizure activity during febrile episodes. Answer: C. Febrile seizures can increase my child's risk of epilepsy. Rationale: febrile seizures are generally benign and do not increase the risk of developing epilepsy in most children. Calling 911 for prolonged seizures, 5 minutes, A, is appropriate to prevent complications like status epilepticus. Fever management with antipyretics, B, can help reduce discomfort, though it doesn't prevent seizures. Monitoring the child during febrile illnesses, D, is a critical safety measure for parents. Key teaching point: parents should be reassured that febrile seizures are usually self-limiting and rarely have long-term effects on neurological health. Question 11. A child with a history of epilepsy is admitted for status epilepticus. Which nursing interventions are appropriate? Select all that apply. Administer prescribed lorazepam for. B. Place the child in a supine position. C. Protect the child's head from injury. D. Document seizure duration and characteristics. E. Apply restraints to prevent injury. Answer A, C, D. Rationale: lorazepam 4A is the first-line medication for status epilepticus to stop prolonged seizures. Protecting the head, C, is essential to prevent trauma during convulsions. Documenting seizure duration and characteristics, D, helps guide further treatment and evaluate effectiveness. Incorrect options: supine position, B, the child should be placed in a side-lying position to maintain airway patency and reduce the risk of aspiration. Applying restraints, E, restraining the child can cause harm and exacerbate injuries. Instead, ensure the environment is safe by removing nearby objects. Question 12. A 2-year-old child with a ventriculoperitoneal VP shunt presents with irritability, vomiting, and lethargy. The nurse suspects a shunt malfunction. What is the priority action? A. Prepare the child for a lumbar puncture. B. Administer antiemetics to control vomiting. C. Notify the healthcare provider immediately. D. Monitor input and output closely. Answer: C. Notify the healthcare provider immediately. Rationale: shunt malfunction can lead to increased intracranial pressure, ICP, which is life-threatening. Priority is to notify the healthcare provider for further evaluation and potential intervention, such as imaging or surgical revision. Lumbar puncture, A. This is unnecessary and contraindicated in suspected ICP due to the risk of herniation. Antiemetics, B. While helpful, treating symptoms without addressing the cause, shunt malfunction delays necessary intervention. Monitoring input and output, D. This is important for overall care but is not the priority in an acute setting. Question 13. True or false? A ventriculoperitoneal shunt requires lifelong monitoring for complications such as infection and obstruction. Answer: true. Rationale: a VP shunt is a permanent device used to drain excess cerebrospinal fluid, CSF. Over time, the shunt may become obstructed or infected, necessitating lifelong monitoring for signs such as fever, vomiting, irritability, or changes in neurological status. Regular follow-up and parental education are crucial to ensure prompt recognition and management of complications. Question 14. Which clinical findings are late signs of increased intracranial pressure in a child with hydrocephalus? Select all that apply. A. Sunset eyes. B. Hypertension. C. Bradycardia. D. Seizures. E. Restlessness. Answer A, B, C, D. Rationale: sunset eyes, A. Downward deviation of the eyes is a hallmark late sign of increased ICP. Hypertension, B. Part of Cushing's triad. Hypertension indicates significant pressure changes in the brain. Bradycardia, C. A late compensatory mechanism in response to rising ICP. Seizures, D. A sign of severe ICP elevation, often preceding herniation. Restlessness, E. While it can occur, it is an early sign of increased ICP, not a late sign. Question 15. A nurse is caring for a child post-VP shunt placement. Which action should be included in the immediate postoperative care plan? A. Position the child with the head of the bed flat. B. Limit fluid intake to prevent CSF overdrainage. C. Monitor for abdominal distension. D. Encourage early ambulation to prevent complications. Answer: C. Monitor for abdominal distension. Rationale: abdominal distension may indicate a peritoneal infection or accumulation of CSF in the peritoneal cavity due to a shunt complication. Monitoring this is critical in the immediate postoperative period. Flat positioning: A. The head of the bed is typically elevated 30 degrees unless contraindicated to promote CSF drainage without overdrainage. Limiting fluids: B. This is unnecessary unless there is a specific contraindication. Encouraging early ambulation: D. While mobility is important, it is not the focus during the immediate postoperative phase. Question 16. True or false? Overdrainage of CSF from a VP shunt can result in sunken fontanelles and severe headaches. Answer: true. Rationale: overdrainage of CSF lowers intracranial pressure too much, leading to sunken fontanelles in infants and headaches due to traction on pain-sensitive structures within the brain. This complication may require adjustment of the shunt settings or surgical revision. Question 17. A nurse is assessing a 4-year-old child with suspected autism spectrum disorder, ASD. Which findings are consistent with ASD? Select all that apply. A. Limited eye contact. B. Delayed speech development. C. Hyperactivity. D. Repetitive hand movements. E. Strong attachment to routines. Answer: A, B, D, E. Rationale: limited eye contact A and delayed speech B are early red flags for ASD. Repetitive hand movements D and a strong attachment to routines E are hallmark signs of ASD, reflecting repetitive behaviors and preference for sameness. Hyperactivity C. While some children with ASD may be hyperactive, it is more commonly associated with ADHD. Question 18. True or false? A structured routine helps reduce anxiety in children with autism spectrum disorder. Answer: true. Rationale: children with ASD thrive in structured environments where routines provide predictability and security. Disruptions can increase anxiety and lead to behavioral challenges. Question 19. A nurse is caring for a child with attention deficit hyperactivity disorder, ADHD. Which interventions are appropriate? Select all that apply. A. Provide frequent breaks during tasks. B. Allow the child to multitask. C. Use positive reinforcement for task completion. D. Create a quiet, distraction-free environment. E. Encourage physical activity breaks. Answer: A, C, D, E. Rationale: frequent breaks, A, and physical activity, E, help manage hyperactivity and improve focus. Positive reinforcement, C, encourages desired behaviors, while a quiet, distraction-free environment, D, minimizes external stimuli that can interfere with focus. Multitasking, B, children with ADHD often struggle with divided attention, making multitasking counterproductive. Question 20. A nurse is educating the parents of a child with spastic cerebral palsy. Which statement by the parents indicates the need for further teaching? A. Physical therapy will help improve muscle tone. B. My child might need help with feeding and dressing. C. Cerebral palsy will worsen over time. D. Assistive devices may help with mobility. Answer: C. Cerebral palsy will worsen over time. Rationale: cerebral palsy, CP, is a non-progressive disorder, meaning the brain injury does not worsen over time. Physical therapy, A, improves muscle tone and mobility. Feeding and dressing assistance, B, may be required for children with significant motor impairments. Assistive devices, D, promote independence and mobility. Question 21. Which clinical manifestations are expected in a child with spastic cerebral palsy? Select all that apply. A. Hypertonicity. B. Involuntary writhing movements. C. Scissoring gait. D. Delayed gross motor milestones. Flaccid muscle tone. Answer: A, C, D. Rationale: Hypertonicity, a increased muscle tone, is a hallmark of spastic CP. Scissoring gait, C, caused by tight adductors in the legs. Delayed gross motor milestones, D, due to impaired muscle control and coordination. Involuntary writhing movements, B, characteristic of dyskinetic CP, not spastic CP. Flaccid muscle tone, E, more typical of hypotonic CP. Question 22. A nurse is planning care for a child with cerebral palsy CP who has feeding difficulties. Which interventions are appropriate? Select all that apply. A, position the child upright during and after meals. B, use thickened liquids to prevent aspiration. C, provide small, frequent meals. D, encourage the child to eat quickly to reduce fatigue. E, collaborate with a speech therapist for feeding techniques. Answer A, B, C, E. Rationale. Right positioning. A, prevents aspiration and facilitates safe swallowing. Thicken liquids. B, help manage dysphagia by slowing the flow of liquids, reducing the risk of aspiration. Small, frequent meals. C, minimize fatigue during feeding sessions and ensure adequate caloric intake. Collaboration with a speech therapist. E, speech therapists can provide tailored feeding strategies to improve swallowing and safety. Eating quickly. D, increases the risk of choking and aspiration and is discouraged. Question 23. True or false? Spastic cerebral palsy is the most common type of cerebral palsy. Answer true. Rationale. Spastic CP accounts for approximately 70 to 80% of cerebral palsy cases, making it the most common type. It is characterized by hypertonicity, increased muscle tone, stiffness, and difficulty with voluntary movements. Question 24. A child with cerebral palsy has difficulty with mobility and coordination. Which goals should be included in the child's care plan? Select all that apply. A, promote independence in activities of daily living. B, prevent contractures and joint deformities. C, minimize physical therapy sessions to reduce fatigue. D, encourage the use of assistive devices. E, provide opportunities for social interaction. Answer A, B, D, E. Rationale. Promoting independence. A, increases the child's confidence and quality of life. Preventing contractures. B, regular stretching, physical therapy, and splinting help maintain range of motion and joint integrity. Assistive devices. D, enhance mobility and participation in activities. Social interaction. E, reduces feelings of isolation and promotes psychosocial development. Minimizing physical therapy. C, this is incorrect. Physical therapy is essential for improving strength, mobility, and function. Question 25. The nurse is educating parents of a child with cerebral palsy about common complications. Which statement indicates a need for further teaching? A, our child might have learning disabilities. B, we will watch for signs of seizures. C, our child will not develop respiratory infections. D, we will provide a high-fiber diet to prevent constipation. Answer C, our child will not develop respiratory infections. Rationale. Children with CP are at an increased risk of respiratory infections due to poor muscle control, which can impair effective coughing and airway clearance. Learning disabilities, A, commonly co-occur with CP but vary in severity. Seizures, B, occur in about 35 to 50% of children with CP. Parents must monitor for seizure activity and administer prescribed anticonvulsants if necessary. High-fiber diet, D, prevents constipation, which is a common issue in CP due to immobility and muscle weakness. That's it for Part 6, Pediatric Neurological and Developmental Disorders. If you haven't watched Part 5, Cardiac and Circulatory Conditions, be sure to check the link in the description. Stay tuned for coming Part 7, Endocrine and Metabolic Disorders. Don't forget to like, subscribe, and share this video with your fellow nursing students. This is Nurse Marcia, wishing you all the best on your NCLEX journey. See you next time.